Back to Good Morning Tobago. Well, viewers, we are being joined this morning for the whole hour with the Secretary of Health, Wellness and Social Protection, as well as the Deputy Chief Secretary. I perhaps have made that portfolio at first. Dr. Faith B.Yisrael, good morning and welcome to you. How are you doing?
Good morning. I'm doing very well, Candace. Thanks for having me. Thanks for having me. Let me start, though, by doing two things. Let me apologize for having to cancel last minute last Friday. It was just one of those days that a lot of things came up. I just could not to do it Friday. So let me apologize to the viewing audience. I would also want to start by sending condolences out to the family of a dear friend of mine, former Assemblyman Mr. Carly Dick,
Yes.
passed away.
And I
And
think we should have a photo coming up soon as well.
yes, and he is from Belgarden. His family has almost, since I got into politics, taken me on as one of their children. So just wanted to say condolences to Mrs. Harriet Job Dick, to the children, Salia, Jamila, Nikosi, the entire family. All of Belgarden is now grieving, and dare I say, the entire island is grieving because of his passing.
Can you share with us any of your memories or, just what him meant to you as an assemblyman, as someone who, had that position at a point in time within our history?
Certainly, I used to get consistent calls from Mr. Dick and from both of them, as a matter of fact. When this happened, I actually messaged to someone. I said, I don't think I can think of Mrs. Dick without him. And I would remember one evening, it was an election, the election that I think I lost by 3, that first election. And in the middle of it, or was it that one or the other one? Anyway, either of them, we did not get the results that we were supposed to get. And in the middle of the night, as I got to Roxborough, because we were still going to celebrate, I got a video call from both of them. And the call was, Faith, we know it's late, but we just want to see your face. We just want to make sure you're okay. And I'm like, yes, sir, okay. I'm in Roxborough. We're going to do whatever celebrations we can celebrate. And they were like, okay, that's all we wanted, darling. All right, see ya. you know. So that is how close that family has been to me, particularly in these trying times in politics. Getting messages from them saying, hold on, this is part of it, giving advice, what to say, what not to say, all of that kind of thing. So this is really a sad time for the Belgarden family. Definitely a sad time for the Dick and all of us feeling his loss.
All right. Now, moving into our conversations today, and of course, we're speaking specifically about, the plans for the next fiscal year, especially as it relates to the Division of Health, Wellness, and Social Protection. And I just want to start with just, I don't know, your overall view of being able to be in this position for the past year and a half. You're someone who has quite a lot of technical knowledge. This is your field in terms of administration of the health sector and so on. How have you been able to function? Have you been able to do what you wanted to do before coming into the position?
So yes, this is, I am one of those individuals who came in with technical capacity, but also history of the division. Because when I came back from school in 2007, I worked for, it was then the Division of Health and Social Services. I worked in the division. So I came into this thinking that I know. Only to realize that there was a whole lot about the process of the way things work that I do not know. And my colleagues and I were dumbstruck. I mean, you walk in on the first day and there are files on your desk and you now need to write minutes and you need to know the difference between a minute number and a folio number. And literally I am thinking, what in God's name? Why does this have to have a bracket? Why is this in a circle? So you mean if I don't sign this document, the whole division, no one gets paid? You mean the TRHA does not get their money if I don't sign this document? And learning the process. So I started my presentation indicating that I was, that this has been my OJT, and my colleagues would also agree that this has been our OJT year and a half, but we are now getting our feet wet. We have a better understanding of how things work, and I think, though, coming out of the coming out of the presentation and quite frankly, even listening to the minority leader ask questions about whether this was done and that was done and the other was done, I actually sat there and thought to myself, you didn't do too bad. You all did not do too bad, because almost every question that he had asked, whether it was done or not, it was done. So I think even though we are still learning as we go along, we haven't done too bad at all for this year and a half.
All right, great. Now, I want to start off some of the questioning in relates to JSC that we had recently, and there was a point that came up about the level of healthcare, things like the MRI machines, and I'm going to throw in the CT scanners as well as the X-ray machines and those things. That has been a perennial problem. For health, especially at that Scarborough Hospital. Where are we in terms of having those very essential pieces of equipment up to standards that can service our people?
Yeah, so you've identified the fact that we do not have the diagnostic tools that are required. So yes, CT, MRI, X-rays, ultrasounds, all of those things. When I came in, I recognized that many of those pieces of equipment were aging pieces of equipment. Therefore, we needed to go out and we needed to purchase them. I specifically did not mention when we were going to do some of those things, as one of the lessons that I learned from last budget presentation. As they say in local parlance, you go up, you present, you buff up your face and say this happening, that happening, and the other happening,
Yeah.
and then reality hits and it does not happen as we had hoped. But I hope to make some announcements pretty soon about, for example, having some additional ambulances on the island. No, for example, these are the little things that people don't recognize. The fleet of ambulances that we had, they all came at the same time.
That was in 2014.
Right. So they all came at the same time. The thing about them all coming 2015 or so, 2014, 2015, the thing about them all coming at the same time is that they're all going to start crashing, as in breaking down at the same time. And that is what we are seeing happening here right now. So they are all limping. So instead of having to find maybe 1 or 2 or 3 ambulances to supplement the fleet, we now have to look for an additional 10 to bring it back up to speed. And those kinds of purchases, of course, are going to cost money. So, for example, what we are doing now with the board, with the CEO of the TRHE and so forth, is actually staggering when we get the ambulances, so that we don't have a situation 10 years down the road where they all, go down at the same time again. So it's little things like that you now have to think through, that may not have been thought through before, but makes a big difference in how these things survive. We had a situation, I think that's an overall Tobago thing, where we do not have maintenance policies for almost anything. When we purchase, for example, a piece of equipment, we should be purchasing parts for the equipment as well. And that has not been happening. So we now have to find the parts of something that we purchased 5 years ago. And those are the types of things that we are working through as we go along. But I do think, though, that you were very clear when you said this is a perennial problem. This is a problem that has been there for a long time. It is a problem that I had hoped would be fixed by now, but that is not practical.
Because if I remember correctly, back in the day, I think when those 10 came in, there was a plan put in place for the maintenance. But what happened to that plan?
Well, I don't know if there was actually a plan and whether it was actually implemented. Now, the thing about the Tobago Regional Health Authority, if you remember, it is an organization that actually has been without true leadership or consistent leadership for a very, very, very long time. And because of that, a lot of the workers felt like, we don't know who to go to. The CEO changed every 5 minutes. The board, we don't know. We didn't have a board for a while. Even before my time, the board kept changing for a while, which is actually one of the reasons I took so long to find the perfect group of people to make up the TRHA board and so forth. So it's really a matter of understanding how all of these little pieces work together and putting the systems in place to make them function. And I am hoping that by the end of this first term, Tobago will see a significant difference. We would not have fixed all of the issues, but you would see a significant difference in the quality of healthcare on the island.
So where are we now in terms of ambulances and well, I know you don't want to stick too much to a timeline, but what's the assurance there in terms of getting this problem fixed?
So you will see ambulances on the island within the next couple months. You would see new ambulances on the island. You would see the ones that we have fixed because we have parts coming in for them. The process, for example, of managing the fleet of ambulances has changed. So let me give you a very practical example. We had a situation before where the EMTs and the drivers on the ambulances were the ones that were kind of responsible for the maintenance of the ambulances. These individuals are not mechanics. These individuals, that is not why we hire them. They should not be burdened with the responsibility of trying to fix an ambulance when it breaks down. So we've actually, if you ask anyone in the TRHA, within the last couple of weeks, they've actually been getting letters indicating, okay, this is who you used to report to before, but this is who you will report to now because this structure that we are now building out now makes more sense. So, for example, the maintenance of the ambulances will now fall under a different manager compared to the actual ambulance service. So it's little things like that that we are looking at, we are doing, and we are doing the assessment to see how they improve the service as we go along.
Now, when the hospital was opened up at Signal Hill about 12 years ago, there was an emphasis on better service, better customer service, as well as shorter wait times in the triage areas and so on. But we're still getting complaints.
No, well, the thing about the wait time in the triage area, in the A&E area, that goes back to the diagnostic tools. So if, for example, someone comes in and they need to have an X-ray, a CT, an MRI done, if those machines are not working, or if you only have one that has to service everybody, that is where the backlog happens. There has actually been an assessment that is done, that was recently done, of the kinds of patients that come into the hospital. And the kinds of patients that come into the hospital will now tell us, as in the kind and the volume, will now tell us which specialists we need to have in the different departments and so forth. So as I said, there's quite a bit of work happening in the background that would not, at this point, you may not see the difference just yet, but when you get closer to the end of the 3 and 4 years, what you would recognize is you may not see the positive, but you would recognize that you're getting less complaints. And that is how we are going to manage, because one of the things we did within the last year was actually implement or reintroduce, because it was there before, the quality department receiving complaints from the population. And we were encouraging people, don't just go on Facebook and cuss. Don't just, quarrel about it. Definitely say to the quality department, this is something that happened to me, so that it is recorded, so that the quality department can do an investigation, and so that we can use that information to try to improve the service. What we are going to be doing is looking at the number of complaints that come into the quality department over a period of time, and hopefully those complaints should reduce, or at least we shift. When you fix one set of complaints, we shift to another set of complaints. That is how we will also know that we are doing a better job. But no, we're not there yet. I am annoyed by how long you still have to wait when you go to A&E. We are definitely not there yet, but it's a process that we are working on.
Well, I mean, and as you mentioned, the CT scanners and so on again, are we still going to private institutions for for those services, and what is the cost?
For some of them, we are going to private institutions. Still, I don't have the costs in front of me right now, but that is why we are looking at, for example, the CT scan. They've started the tendering process for those have already started. We are looking at the getting more MRI, getting an MRI machine, not more, getting more dialysis chairs and those kinds of things. So that process, the procurement process again, and now with the new procurement legislation being now law, that has kind of put a little kink in the system again. But we're still working through all of it. The good thing is that it's the entire country that's feeling the strain of this new law. But a lot of the tendering processes had actually started before that. So we are now just continuing them. Another thing that we want to do is work on the full digitization of the health system. So right now, for example, if you go to the lab, if you go to the pharmacy, you would recognize that the professionals are there. They're pulling up your name and stuff on the computer, and they're doing it that way. We've already started working with the company that is there doing this already to see what it would cost to do a full plan to build it out so that eventually it's not going to happen right now because it's going to cost quite a bit. Eventually, when you get to the hospital, for example, no one has to go physically looking for a paper file, a paper thing for you, but it would all be on the tablet that the doctors
And would it be
have.
accessible to the patient itself? Because you know that's a concern.
That is a concern, and that would actually make it easier for the patients to have access to their information. I, for example, have I have experience with my grandmother being in a hospital in Florida, and me in Tobago being able to pull up her notes to see. So all of those things are what we are building out with the company that is already there, because we were doing some analyses. Should we start from scratch, go with somebody else? But we kind of decided it was best. We already have parts of the system in place there, so let's just fund building it out, and hopefully we are able to do this sooner rather than later. So even that would help in the processes as you go into the health system.
All right. Well, we're going to take a quick break, but when we come back, we'll continue our conversation with the Secretary of Health, Wellness and Social Protection, Dr. Faith B.Yisrael.
Tobago updates. Good morning, Tobago.
Welcome back to Good Morning Tobago. Viewers, we are speaking with Deputy Chief Secretary and Secretary of Health, Wellness and Social Protection, Dr. Faith B.Yisrael. All right, so Dr. Faith, we were speaking about some of the services, specifically at Scarborough. But one of the things I know that you've been very much behind is, sort of setting up places in Tobago where we can disaggregate some of the services within our healthcare system. And with that, I want to bring in to the conversation Roxborough Hospital. And what's the update happening at Roxborough Hospital? Because, well, it's not quite a hospital yet.
Yes, it's not quite a hospital yet. We are getting there, we are getting there, we are getting there. We are crawling, getting there, but we are getting there. So right now, you can get outpatient services. So really any of the clinics that you would normally go to Scarborough for, you can get them at Roxborough. We now have accident and emergency services from Monday to Friday, 7 to 7. So that's accident and emergency, Monday to Friday, 7 a.m. to 7 p.m. We are now working out the system of trying to expand that to weekends. So hopefully within another couple of weeks, I'll be able to announce that you can get accident and emergency on weekends as well. And we've been able to do some day surgeries because the theater is there with the equipment. And that's why we were able to do the cataract surgeries up at Roxborough, because the equipment to do surgeries is there. And we actually purchased some additional actual equipment to do cataract surgeries in Roxborough. So that is available. Hopefully before the end of the year, I hope and I pray before the end of the year, we will be able to say, yes, we have all 24-hour services. We now have inpatient services. The thing about that, though, is that we're actually finding it pretty difficult to recruit some of the specialists that are needed to provide the inpatient services. You probably saw an advertisement from TRHA a couple of weeks ago asking for all of these specialists. Again, that is them trying to get the staff so that we can move to 24-hour full hospital services. What we've been doing, though, is because we understand that all of these things are not necessarily working within the system, we've been trying to do short projects that get people the services that they need. So, for example, coming out of COVID, we recognized that there were a lot of women who did not have pap smears done. So we did the Don't Fear the Smear campaign. That came up with over 1,000 samples being tested. And of the 1,000 samples being tested, we actually had about 19 or 20 individuals who we picked up needed to get further screening, needed to get further testing, needed follow-up. That means we saw something that was kind of iffy, and hopefully we got those 19 women in time to prevent it from going all the way down to full-blown cervical cancer.
So is it that we're doing this through Roxborough and not the Pink Room as it was established for?
So that particular project, we actually used 22 facilities throughout the island.
Okay.
So it was approximately a month long. We had the professionals. We actually brought in some retired nurses and so forth, retired DHVs and so forth, to go around to the different health facilities. So we did not stop the regular functioning of the facility, but we added this service for the month where we went to different health centers. So, this Monday we would be in Pembroke, Tuesday we would be in Bell Garden. That is the way it was done. And that included all of these rooms and so forth. It also included partnering with private entities because we actually had a private lab that we sent the samples to the private lab. We also had private doctors and so forth be a part of that. Now, you spoke about the Pink Room, and let me indicate that we are actually in the process of transferring the Pink Room and the Blue Room to the Tobago Regional Health Authority, because when I came here, I recognized that I understand why Dr. Agatha Carrington did some of the things she did. I actually, being in this position now, I am actually a little bit more, and imagine me saying this, I am more understanding of many of the decisions that she made, actually. But we recognize that we needed to manage our resources. So, for example, when I went to the Pink Room and recognized that the Pink Room is here, and literally when you look down from the Pink Room, the Delaford community, the Delaford health center is literally right down the road. I mean, 10 steps and you are there. I asked, why would we not consolidate, and why would we double the resources? Because we now have to maintain 2 buildings. We now have to paint 2 buildings, AC for 2 buildings, that kind of thing. So we are actually working towards incorporating the Pink Room, the Blue Room, and all of those back into the TRHA, and looking at the models of care, the models of management of these quote-unquote rooms, to ensure that while they are reincorporated into the TRHA, they actually provide the services that the people of Tobago need.
Right. So, and then going back to the Roxborough hospital, not yet a hospital,
health
facility. Okay, so what are the services that you are thinking about in terms of what's the vision behind the specialist services to be offered at Roxborough?
So we want Roxborough currently has, as I said, outpatient clinics, pharmacy, lab, dialysis, A&E, and so forth. The aim is for individuals in the East to be able to use the Roxborough Hospital when it is a hospital instead of coming to Scarborough. That is the ultimate aim. We recently were able to work out the management of some of the imaging pieces of equipment, because we have imaging equipment in Roxborough, but there were issues with management and how you get scheduled to get a CT scan or to get an ultrasound, and those kinds of things. So those things are what we are working out in the background to ensure that we provide a service. But the aim is, if you live in Tobago East, you should be able to go to the Roxborough Hospital when it is really a Roxborough Hospital and get practically any of the services that you need at Scarborough. What we've recognized is that probably it's because of the newness of Roxborough. We recognize that there are people who are now leaving town, leaving the West and going up to Roxborough because it's easier, the wait time is shorter, they seem to get better service when they go to Roxborough. So I've been getting those compliments. So let me say kudos to the staff at Roxborough for that, because even town people now going up to the East to get those kinds of services. And that is how we envision it happening, where it doesn't matter where you are and it doesn't matter where you go, you would get good service. We are working towards that. We recognize that there are issues with, customer service and that kind of thing, and we are also building out quite a bit of training for the staff at the different facilities to figure out what is the situation, what is the issue, why are people complaining, about the nurse probably not being as polite as the nurse needs to be, and that kind of thing. So we're working out those things in the background. And as I said, hopefully by the end of the first term, we should see significant improvement.
All right, well, we're going to take another quick break, and when we return, we'll continue our conversations with Dr. Faith B.Yisrael. Don't go anywhere.
Tobago updates. Good morning, Tobago.
Welcome back to Good Morning Tobago on Tobago Updates. Viewers, we are speaking this morning with the Deputy Chief Secretary and the Secretary of Health, Wellness and Social Protection, Dr. Faith B.Yisrael. Now, Dr. Faith, I want to turn a little bit to social services and just, some of the things within the space. One of the biggest complaints that we hear from the public is that they don't have the access to the food cards and, some of the disability grants and so on. So what's been happening there? I know that some changes were made to the structure. So give us an idea what's happening.
Right. So coincidentally, the two things that you just spoke about, even though they happen to be housed in our building, as in the Division of Health, Wellness and Social Protection and TRHA head office, the general food card, the disability grants, old age pension, and all of those are actually not managed by the Tobago House of Assembly. And they follow the policies of the Ministry of Social Development and Family Services, I think is the name of the ministry. So yes, I get a lot of complaints. I get blamed for a lot of what is happening, and coincidentally, they are in the same building with me. So it seems as if we are the ones that are managing it, but we are not. What we are responsible for example, are the green emergency food cards. So you need to have had an emergency, a fire, a flood, you just lost your job or something like that to get those food cards. We are now really looking at, given all of the issues with the ministry food cards, the red ones, we are now looking at trying to figure out if there's another way that we could supplement food support for Tobago families, because we recognize that what they are doing is simply not working, so we have to figure it out.
So is it that is it a legislative issue where we can't give a more steady food cards?
No, there isn't a legislative issue. It was just that because we also have very limited budgeting. And when you look at the budget of the entire THA compared to the budget of some of these ministries in Tobago, and because they were already providing a service, we did not want to duplicate the service when we already have limited funding. So what we've done recently, we've actually reworked the policy at the division, Department of Social Protection, that includes shifting, for example, our emergency food cards. Before, it was a $500 one time, that's it kind of thing. You have to come back to renew it every month if you needed it renewed every month. So we switched that policy where the size of the family would determine the amount of money you get on those food cards. And we are also giving it for 3 months instead of 1 month, and with the ability to renew after the 3 months. So we've been looking at those little changes. We've also shifted the policy at Social Protection for several other things. So we've now looked at what is required, some of the paperwork that's needed. We've now started reintroducing for for example, kinship care, which was there before, which means, if you have your granny and the mommy or the daddy died or something, and the granny is now taking care of the child, or the aunt or the uncle, the mommy is, having issues and they can't take care of the child. So the aunt and the uncle is now taking care of the child, but you need a little bit of support. We are now putting those in place to provide that kind of support for families. We are going through the policies right now. We are going through a pilot phase where we try to work out the different kinks, try to work out which ones we use the means test for, how is the means test working, and that kind of stuff. And then it will be expanded to the larger population. So right now we are looking closely at what these improved policies do and how they work on the ground before we expand them. It's important to note, though, that we have actually done quite a bit, not as much as I would want to. So, for example, we have given out close to $300,000 in REACH grant, and REACH is the grant that allows people to start micro businesses. So, if you come in as a social protection client, you wanted a food card, you want rental assistance or whatever, but you have a business idea, we are saying, okay, we will give you up to $15,000 to do something for your business, so that you start a business and you don't have to keep coming back to us for the food card and that kind of stuff. We recognize we actually just shifted management of that program, and when the new management got in, we realized that there were applications there, 200-300 applications just sitting there. So 2019, 2020 applications with those dates are sitting there, and we are now trying our best to go through as many of those as possible. We've provided medical assistance in over $1 million within the last year or so. So it's those things that we are trying to push. We just hired a couple more social workers and therapeutic counselors and that kind of thing to ensure that we are thing. As a matter of fact, the lady who is managing the therapeutic counselors, she said, therapy is now becoming the in thing. All of our therapeutic counselors now are swamped. They all have so many cases. And when they are finished with a client, the client is then referring their friend or their cousin to come and get therapy too. So we are working on beefing up all of those things and aiming to provide those services closer to you. So you would now see, for example, more of our social workers and our counselors and so forth coming to the community centers near you, coming to the health centers near you, so you don't have to come all the way to town to get those services. And those are the kinds of things that we are hoping to push out next fiscal, to provide these kinds of social support to the people.
Now, some of the complaints in terms of those services, especially the food cards, because I mean, we hear those complaints all the time that there were people who were getting the support, and then all of a sudden the division cut it off. And I don't know if it's a political thing, and you hear all those things coming about. But I want you to take some time to explain, why it might happen that some people get off the food card system.
So, and I'm glad you raised that point, because that was one of those coincidental things that were just horrible. The Ministry of Social Development are the ones who manage the red food cards. The government and the ministry, sometime just before elections, decided that if you were getting any other social support, social welfare support, so if you were getting a food card plus you were getting a disability grant or an old age pension or whatever, they would take away the food card. Kandace, it just so happened that they take away the people them food card the day after we got elected. That had nothing to do with the Tobago House of Assembly. Absolutely nothing. And people were going away with the idea that, PDP at the time came into power and we take away all of these people food card, which had nothing to do with us. That was a national policy where they have a national board and so forth that manages that process. So again, it goes back to having people understand what the process is, and having them recognize that, even though it is happening in the Tobago space, it is a central government policy that was actually implemented and not a Tobago House of Assembly policy. But the other thing that I wanted to raise very quickly before we run out of time is the fact that we really are hoping to pilot the My Tobago. The Chief Second
Yes.
Secretary for Finance, Trade and the Economy, spoke about this My Tobago online platform that would allow people to access services within the Tobago House of Assembly through their digital devices. And we are actually going to use the Division of Health, Wellness and Social Protection really as the pilot for that. So if you need to apply for rental assistance, for example, or for one of the emergency food cards or any of the other things that we are offering, soon and very soon, you would be able to do send in, a copy of your ID card and whatever forms you need to send in online. And we are hoping to get it also to the point where you don't even have to come in, for example, for anything. But if you have a phone, you should be able to, if you have the food card, for example, you don't have to come for the hard food card, but you can go with your phone to the grocery and use your phone as the mechanism to use the food card. So those are the kinds of things that we are working out. It is taking time, it is taking effort, it's taking money to build out those systems, but it is something that we are working on, actively working on at this point. I can't wait to get to the point where I come back. I'm not giving any timelines, Kandace. I'm not falling for that trap again. When I come, I will come and make an announcement. We start.
And then what about the policy behind it, managing it? Because like we saw the changes that are happening with the Ministry of Social Development and the consequences of it. Now, is Tobago adopting a similar policy where if you are receiving a certain grant here, you can't apply for any others?
No, we do not have that policy at all. As a matter of fact, the social workers are the ones that collectively look at what is happening, and based on your need, we will provide the service based on your need. And we've also been able to have the case conferencing happening. So, for example, social workers from the hospital, from social protection, from settlements, from education, and so forth, at least once per month, they actually come together to look at complicated cases to see, well, okay, so this person, this client, this family needs help from these three divisions. Let us work together to get them the help from these three divisions instead of just sending them, okay, go to health or go to settlements or go to education. No, the social workers are coming together, sitting in a room together, working out what is needed for these clients to provide the services. I have to admit, though, that we have kind of one hiccup at the division that I have not been able to get a full hold on just yet. And that is really the actual processing of the payments. So it goes through the entire process. The social workers make their recommendations. It goes to the board, the social assistance grant board, and it gets the final approval. But I recognize that I have one little bottleneck, which is when it then goes to accounts. The same accounts that is processing salaries and this, that, and the other is the same accounts that now has to process paying the rental assistance to a landlord and so forth. So we are really, really now trying to work out how we treat with that little kink. Hopefully when we get to the point of having the digital thing, that makes it a little easier. But until then, we are trying to work out. I actually had a meeting with the accounting executive one, the administrator, and so forth last week to work out how we get that little kink, because we have a lot of applications that have been approved, but they haven't gotten to the end stage of being paid out just yet.
All right. Well, I want to move now in the last 3 minutes that we have towards primary health care. And especially where NCDs are concerned, I know over the past decade or so, there was a lot of focus on that. COVID-19 kind of took away the focus, but now that we're getting past COVID-19, how are we treating with NCDs, especially throughout our primary healthcare?
Yeah, that is actually something that is critical. NCDs are things that we can prevent. Fortunately or unfortunately, they are things that we can prevent. So again, we are trying to build within the primary health care system the ways to treat and manage. But from the divisional standpoint, let me big up, so to speak, my assistant secretary for actually starting a program, exercising with the assistant secretary. So every Tuesday and Thursday, and on Sundays they go on hikes. So every Sunday morning they go to a different location to go on hikes, and you could actually come to the division's car park on Tuesdays and Thursdays afternoon at 4:30 to exercise with the assistant secretary. We would also be building out a full wellness program around that, basically saying, this is how you're going to eat, this is how you need to prepare the smoothies, this is how you're going to cook the food with less salt, and those things. Because again, as we said, what we want to do with NCDs is to prevent them getting the NCDs. So we are funding and doing the programs within the health centers and the hospitals and so forth, but we are also encouraging people to prevent these things by exercising and eating correctly and that kind of stuff.
All right. Well, I think we got it all for now. We're certainly looking forward to what's going to happen. I just really quickly, I know one of the things you started when you came in was that of inviting our diaspora to be a part of the health system. How has that been working?
So that is actually something that it worked a bit at the beginning because we were doing it specifically as
For
it relates to COVID-19. We are still encouraging them to come in, and that's why the advertisements, for example, for the specialists, having them come in, please apply. If you know anyone who is a specialist in whatever field, medical field, because you may not know what it is, you just know this person is a special doctor, point them in the TRHA's website, because we have those ads going out all the time for specialists within THA. Even if you don't know, just send me a note that says, hey, Dr. Faith, this is somebody who, we think we might use. And then I would say, okay, TRHA, is this a specialist that we need right now? And we would go from there. But we are continuing to encourage people to come be a part of the health system in Tobago, because our aim really is to build the best system for our locals, definitely. But we really, really want to get to the point where people actually, instead of us going to Trinidad for health care, we want to get to the point where Trinidadians come to Tobago for health care.
That is certainly a point to get to. All right, viewers, I want to thank you. Thank you, Dr. Faith, for being on with us. It's certainly a pleasure. And we're looking forward for those updates in these coming months of what has happened within the different areas of the health sector, health and social sector. All right, viewers, that's it for the program today. Thank you for joining us, and we will see you again tomorrow.
Wake up with Kandace and Denise. Let's go. It's a brand new morning. Rise up to a brand new dawning. As the passion start to rise, the energy fill the skies. I say thanks a favor to wake up and hear me.